Kinesiology taping for runner's knee, or often known as iliotibial band syndrome. So what is it? It's a common injury where your patients will experience pain on the lateral side of the knee. It's something that's seen frequently in runners, cyclists, or people that do lots of squats, and commonly it's an overuse style injury. Before we look at some of the potential causes of this, let's just recap on the anatomy relevant. So let's start with the iliotibial tract, or the iliotibial band. And this is a thick band of fascia that runs on the lateral side of the thigh, connecting the iliac crest to the knee. It is the tendon of the tensor fascia lata and the gluteus maximus, and it inserts down into the lateral tibial plateau, so it crosses the knee joint. The gluteus maximus insertion point is the iliotibial tract, so the strength or functionality of that muscle can directly affect the iliotibial band at both ends, so more the proximal and also the distal end around the knee. The tensor fascia lata also inserts into the iliotibial tract, so the combination of the gluteus maximus and the tensor fascia latae has the impact, or can have the impact, on the iliotibial band and the insertion point in the lateral knee. Some potential causes of the runner's knee or iliotibial band syndrome is often due to some overload or overuse, and it potentially is due to repetition of flexion and extension. Some of the research has suggested that it may be due to friction between the lateral epicondyle and the iliotibial tract, but one of the things to consider is that it's potentially due to a weakness or a muscle imbalance in the abductors of the hip. So referring back to the previous slides, the abductors, you're looking at the gluteus maximus and then also the tensor fascia lata. Some treatment considerations. You want to begin with assessing the hip range of motion and strength, and also rule out any other contraindications, or if you are able to diagnose, any other diagnoses. We're going to focus on some tendon plane and inflammation reduction using kinesiology taping, and any perceived tightness in any of the muscles surrounding the knee or the hip. Taping for the acute and the early subacute phase. This has a 3-step application for taping, and you can just use either or of the tapings available, but we've gone for all 3 for the demonstration for this patient. We're going to begin with some inhibition taping of the iliotibial tract. Then we're going to focus on some tendon offload from the lateral side of the patella, and then also some taping for desensitization at the area of pain. Other taping options to consider. The first one would be lymphatic drainage taping if there is any inflammation that is present around the knee. And then also if there is some anterior knee pain, the anterior knee pain taping may also be useful for this patient. We begin with inhibition taping for the iliotibial tract. So we begin the anchor point just below the knee towards that lateral tibial plateau. And then with a straight leg, tension is light on the tape, and we apply the tape along the line of the iliotibial tract. We bend the knee to apply the anchor, and then get your client, or you can lift your client's shorts up to attach to the top of the IT band. Rub the tape to activate the tape. And then we move on to taping around the knee. Focusing on the lateral part of the knee with the client supine. We take the tape and break off in the center of the paper. And then with the client's bent knee, take a heavy tension of the tape, and the tape is applied inwards towards the patella. Rub the center of where it's been attached, straighten out the leg, and then add both anchors and rub the tape to stick down. For desensitization, the client will let you know where they have been experiencing pain. A smaller amount of tape, break off the paper at the back, and with a light tension of the tape onto a bent knee, apply the tape over the area of pain. Rub the tape down, straighten the leg, stick both anchors down, and rub the rest of the tape to stick the tape down.